to kick this initiative off, we're starting with Srulik Forsky, the CEO and co-founder of Tailormed, who's sitting really not too far away from me in the same neighborhood. But still we're keeping up with the restrictions that are placed upon us. And Srulik, maybe just to get it started, you could give us a little bit of background on what Tailormed is all about pre-corona.
Sure. Thanks for setting this up, Natalie. Tailormed is a health IT company that is building solutions to solve a problem that stems from the fact that millions of Americans have high out-of-pocket expenses for their treatments of chronic and critical conditions. Basically, our platform allows patients and their healthcare providers to identify alternative resources to finance their care. And by that, we are reducing the patient's financial toxicity and financial hardship and increasing revenue collections for our provider partners.
You're still an early stage company, but already have in the last year and a half or so been working in the US market with customers. Given that now we're grounded and most of the team is here in Israel, and you have a team in the United States that can't really do any domestic travel, how are you dealing with supporting your existing clients, and what kind of workarounds have you done there to make sure that things stay on track to the extent that they can during this period?
Sure. So I think that obviously, as everybody is getting the emails from their vendors of we are still here and we are working remotely from home, we've done this, we've done that also. But we found early on that like our customers are hospitals, so they are coming to work in a lot of cases, but most of the staff who are using our systems are not essential staff. So they might be required not to go into their clinics and hospitals. So one of the first things we started, even before the customers asked us to do it, is our DevOps team and customer success pretty much overnight changed the infrastructure of our system to allow them to work from home. And this was something that allowed them to have continuous services to their patients without the need to stop. Actually, something that some of the EMR vendors that they are working with didn't allow, at least to this date. So that was one thing that we have done with our existing customers, which they really appreciated. And another approach that we have taken internally with our core team is kind of saying, until stopped, we are moving forward. And that maybe alludes more to our new customers and the ones that are going live. So I don't know if it's luck or good or bad luck, whatever, but our biggest account ever was set to go live just when they closed the skies here in Israel and also in the States. And we eventually talked with them and made a joint decision to go live remotely, which is something that we haven't done with accounts their size. And I think that it was perceived very well by them because they saw that we are going above and beyond to make sure that we are continuously giving them value. And for our team, it was a chance to kind of revamp or restructure how we do training and onboarding and do it remotely, but as far as we can without getting any blocks from the other side, maintain our business plans. So I would say, in short, thinking about their needs ahead of what they really share with us and try to move forward until being stopped.
Yeah, so congratulations. I was very excited, and you sent me the snapshot while it was happening. Yeah, amazing effort, and so far a great success. Specifically around COVID, what specific initiatives, proactive initiatives, have you taken as a company internally, and inbound and outbound? And I'm not talking about the cost cutting and adapting forecasts, etc., but really initiatives that can drive value into the healthcare system through this lens of COVID-19.
The problem that we are trying to deal with is problem that patients are getting care but cannot afford their treatment. That problem will not go away. People that are diagnosed with multiple sclerosis and cancer and others still have that diagnosis, still would consider the treatment critical, and they need to get the care that they need without the ability to afford it. But what's happening is exacerbating this problem even more, because they cannot go to the clinic to something that is a financial counseling visit, and their financial counselors or the staff social workers who is going to help with that cannot come to the office as well. And kind of with that notion, we understood that we have to try and adapt our solution to this day and age, this crazy day and age, I have to say. So basically, what we've done is said, we see that we have telehealth on the one hand that is doing like remote physician visits and monitoring. Why not adapt what we have and allow patients, physicians, and providers to use the technology, but also for financial navigation. So basically, this week we launched a new product that basically our team, a task force that we took out of the main team, worked on day and night for the last 10 days. We call it Tailormed Remote Navigation, basically allowing either our existing, but also other providers to try and continue this process of delivering financial navigation, finding resources for patients for COVID-19 expenses, but not only, because a lot of the implications on the economic implications and implications on patients is loss of wages. Loss of wages in America means also loss of coverage, of insurance coverage. So I think that the problem, as we view it at the moment, is even bigger. And we're trying to bridge the gap of not being able to come into the office with remote navigation.
So actually, you developed in a very short time kind of a low-touch version of the product that can give value specifically for COVID, can help with onboarding of new clients in this kind of difficult logistical situation that we're dealing with, and also drive additional value to your existing customers. Is there anything in your career and personal experience that prepared you for this kind of challenge?
I'll be humble to say not really. I think that I'm no different than anybody else that is facing something that is unprecedented, at least in modern life or in connected lives. Maybe 100 years ago, there was something in that magnitude. But if I need to think about it a bit more, I'm going back to army service. Although I wasn't a combat soldier, we were working on projects with high stakes and the ability to move fast during military operations with technology kind of resonates to me from time to time. Most of my career was spent in one company called BrainsGate, where another startup with not that magnitude of a crisis, but we had some crises, and being mentored by my previous CEO of Inoam, who was, I think, a very calm, but very data-driven, but also forward-looking CEO in crisis management situations, are things that I'm trying to adapt now as well. And maybe, I know that you are a big fan as well, Natalie, but reading and hearing podcasts, I'm going back to a lot of recordings and books that I read on companies that failed or succeeded around 9/11 and the financial crisis of 2008. Mm-hmm. And time will tell, but I think that I'm trying to lead us with our management team to try and be on the better side of whatever comes next. We need to be agile, and we have an edge as a small and young company to be agile in this crisis mode. So talk to me in a few months. Let's see where we are.
Yeah, I'm not going to wait a few months. I'm going to talk to you every few days.
I know, course. But for the sake of whomever is listening.
But so first of all, I want to thank you. I want to say you guys are amazing. You and the entire team. We love you. We love the work that you're doing, and we know that you're addressing a huge problem with real value to a lot of people. And I'm going to ask you for a COVID high five.
No, it's with the elbow.
It's a bump. You're right, right?